Hi everyone. Today we are discussing about anatomy of tongue. First, we can discuss about the development of tongue. It starts to develop near the end of fourth week, and the anterior two-third of epithelium from two lingual swellings and one tuberculum impar, that is from first branchial arch, and it is supplied by lingual nerve and chordae tympani, and posterior one-third from the cranial half of the hyperbranchial eminence, that is from the third arch, and supplied by glossopharyngeal nerve. Anterior two-third from the first branchial arch and posterior one-third from the third branchial arch. Then posterior most part, it's from the fourth arch and supplied by vagus nerve. The muscles develop from the occipital myotomes, which are supplied by hypoglossal nerves. Connective tissue develops from the local mesenchyme. Now, external features of tongue. First, a root, second, a tip or apex, and a body. The body has a curved upper surface or dorsum, which has oral and pharyngeal parts. An inferior surface or ventral surface which has oral part only. First, root. The root is attached to the mandible and soft palate above and to the hyoid bone below. Two attachments above mandible and soft palate, below hyoid bone. Because of these attachments, we cannot able to swallow the tongue itself. Then the tip. Tip of tongue forms the anterior free end, which at rest lies behind the upper incisor teeth. Then the body of tongue. It has two surfaces, upper surface or dorsum and an inferior surface. The dorsum is divided into oral and pharyngeal part. This is oral part and this is pharyngeal part. Now, dorsum of tongue. It is convex in all directions and it is divided into an oral part, that is anterior two-third, also called as papillary part, and second pharyngeal part or posterior one-third. This oral and pharyngeal part are separated by a faint V-shaped groove. The V-shaped groove is known as sulcus terminalis, and the two limbs of V meet at a median pit called foramen caecum. This V-shaped groove is known as sulcus terminalis, and this is foramen caecum. The thyroid diverticulum grows in an embryo at this site of foramen caecum. Then the ventral surface. It is smooth because it has no papillae. This smooth mucous membrane which shows a median fold, it is called as frenulum linguae. On either side of frenulum there is a prominence produced by deep lingual veins, and more laterally there is a fold called plica fimbriata. This middle part is frenulum and this blue part is deep lingual vein. On lateralmost part we have plica fimbriata. Then the pharyngeal or post-sulcal part, that is behind the sulcus terminalis, and is lies behind the palatoglossal arches and forms the anterior wall of oropharynx, and this part devoid of papillae but has many lymphoid follicles that collectively constitute the lingual tonsils. These blue-colored parts behind the sulcus terminalis is lymphoid follicles, and together they are called lingual tonsil. This is all about external features of tongue. Then Papillae and muscles of tongue we can discuss in next video. Thank you.